Hi, I'm John Wilson, President of the Royal Australasian College of Physicians. We're currently embarking on one of the most critical times in recent medical history, the rollout of the COVID-19 vaccine. It's exciting to see the vaccine rollout is now underway in both Australia and Aotearoa, New Zealand. Both countries are starting with border, quarantine and frontline workers to try and minimise ongoing COVID-19 risks in our community. We have been actively advocating for a well thought out and well executed vaccine program. Last October, we wrote to Australian Government Health Minister Honourable Greg Hunt. I'm pleased to say the Minister is implementing many of our suggestions, including improvements to the Australian Immunisation Register, expansion of the AUSVAC safety system to support vaccine safety, the involvement of expert social scientists in communications and messaging to support the uptake of the vaccine, and development of a publicly available vaccine delivery plan. The College's COVID-19 expert reference group continues to lead our policy and advocacy in this space. I'd like to thank the team, the staff, and all involved for their work in this area. The safety of our members and other healthcare workers is also of critical importance. Please know which vaccination group you will fall into and get yours as soon as you can. I was very happy to get mine recently, and I already have my second dose marked in my calendar. Please also support your friends, family and patients to know when it's their turn and encourage them to get their jab. We must improve herd immunity. We can be confident in our country's plans as well as the vaccines which have been proven to be very effective in reducing serious disease. Many of our members have been involved in various COVID vaccine projects, whether you've been involved in any of the approved vaccines, one that's still in development, or even those that are still yet to make it. Thank you very much indeed for your involvement there. It's amazing to see what our community has achieved in such a short amount of time. Everything we've learned from the pandemic will support us in future pandemics and like events. There's also lessons for our health systems more broadly. Speaking of what we've learned, COVID accelerated the use of telehealth across our countries. Here in Australia, the government has agreed to extend telehealth in its current form until at least the end of June. This is fantastic news. So far, more than 51 million telehealth services have been delivered to 13 million patients in Australia. The government has committed to the ongoing role of COVID telehealth into the future. And what form this will take will be discussed with peak medical groups, including our college. More information about the vaccine rollout strategies in Australia and Aotearoa, New Zealand, as well as resource and RACP events, is on our vaccination page on our website. Thank you for listening.